Hey guys, and welcome to the very first episode of the FuncMed Nation podcast. My very first guest is none other than Dr. Datis Kharrazian. Many of you guys I know will know that name. Perhaps you've seen him lecture personally or you've done some of his online learning. What I wanted to do before we get to the episode podcast is just pull out a couple of things that he and I talked about and some words of wisdom that might pique your interest so that you can listen for them as you go through the podcast. The first thing is a comment that he made about, as clinicians, we are constantly trying to make complex things very linear, but human physiology is anything but that. He also said that one of his frustrations with functional medicine was this idea that if you're not knocking every case out of the park and getting everybody well, then you're doing something wrong, and that's simply not the case. And the reason why is because you are not the only variable in the equation. He's very adamant that real functional medicine practice has successes, but it also has failures. And many times, clinical success comes only by making adjustments to decisions that you've already made that are not working. And he concludes that your patients are going to be your best teachers. He says that your time with each patient is a privilege and an opportunity to learn. And without further ado, here's my interview with Datis Kharrazian. I want to welcome everybody today. I'm pretty excited about this. I've actually got my first professional guest for a new podcast called FuncMed Nation. And today we're going to be talking with Datis Kharrazian, who has been a colleague, a mentor, dare I say, a friend of mine for the past, 15 years or so? It's kind of hard to believe it's been that long. But you pause. Let me just read a little bit, just for anybody who doesn't know Dr. Kharrazian. He's a Harvard Med School trained and award-winning clinical research scientist. He's an academic professor, a world-renowned functional medicine healthcare provider, and he develops evidence-based models to treat autoimmune, neurological, and unidentified chronic diseases with non-pharmaceutical applications. His clinical models of evidence-based medicine are used by several academic institutions and thousands of healthcare providers throughout the world. And Dr. Kharrazian is an associate clinical professor at Loma University School of Medicine. So I'm honored to have you as my first guest on the podcast here. Welcome and thank you for being here.
Of course, Steve. Yeah, we go back. We're good friends.
Yeah, it's been a while. Like I said, it's kind of hard to believe, actually, when you think about it. The last 15 years have been a little bit of a blur. I have one question to start out, and I want to know, are you at the point now where you don't list all of your credentials just because the list is too long?
Yes.
I kind of figured that. And I have to tell you, there was... I can't remember. I was teaching for you one of the Apex seminars, and can't remember what city it was, but it was several years ago. And we kind of went through the introduction and did the first morning segment, and then one of the docs came up to me on a break and said, "Wow, your list of credentials are very impressive." And it turned out that on the title slide where it shows you and all your credentials, they thought that was me.
Nice.
And so for a very brief moment, I just kind of entertained the thought of letting them believe that that's what my educational background was. But it was that was kind of funny. I've remembered that just ever since it happened. So one of the things I want to know is I want to know about your early career. Like, you and I have had a couple of conversations over the years where, we just brief snippets of time and kind of teased around these questions before. But I kind of really want to know, like, how you got into functional medicine, and did you have to transition, as many of us in FuncMed do, or had to? Did you start out in kind of a standard chiropractic musculoskeletal practice and then have to transition, or what did those early years in practice look like for you, and how did you to the point where you said, okay, I am now a functional medicine practitioner?
Yeah, so for me, it started with just having multiple shoulder dislocations when I was in my 17, 18, 19 teens. And I so I had to have surgery. And at that point, I decided I was going to go into chiropractic school because I was doing martial arts. And I thought, oh, how cool, I can do martial arts. And then I can learn how to treat people and I can learn about anatomy.
Yeah.
A lot of functional medicine never really entered my mind. And then I went to a chiropractor, and he's like, "You don't need an adjustment. You need to work. You need some manganese and some collagen nutrition, and you need uh, to focus on that." And then he was right, and then I didn't have any more dislocations, and I was like, "Okay, this is pretty amazing." And I just kind of thought about it, and then went to chiropractic school. And during this time, I had a family member who was really sick, and when you're a chiropractic student or any kind of student, you go to different conferences and seminars. There was a free seminar on blood chemistry analysis. Um, so I went to that seminar, and I'm like, wow, this is really interesting. And then the person who was teaching it was Harry Near at a time, and
Mm.
he was he's like, hey, I go, I have a mom, I have a person who's really sick. Um, what can you help me? He's like, yeah, just get a blood test, send it over. And I said, okay. So we got a blood test, sent it over. He gave me some recommendations. I tried it, and it worked. Helped the person. It didn't like cure them or do anything, but did make a difference for them. And
Yeah.
like that was really supportive. And then during the same time, I really got into applied kinesiology, which is like esoteric muscle testing kind of technique at the time. And I really got to have a mentorship with the founder, Dr. Goodhart, as a
Mm.
student for students allowed on the board and ICAK board at the time. And he's like, Datis, what I hate most about what's happened to applied kinesiology is everything's been based on muscle testing. He goes, I don't do that. He goes,
Really?
I do routine blood work in every single patient. I
Yeah.
do barometric assessment. He goes, I do 25 things before I even do my first muscle test. And this is what I think AK has gone wrong. And at that point, I don't know if they thought I was going to be a future leader in that model or not, but it sure felt that way. And he was like, you have to learn how to be a diagnostician, and you need to learn things like blood chemistry, because I was talking about a blood chemistry when I went to, and I'm like, okay, like if Dr. Goodhart told me I need to do this, and I was maybe 21 years old at that time, and I'm like, okay, I'm going to learn blood
That's a
chemistry.
lot.
So then I got to just really focus on blood chemistry for a while, and while I was a student, was able to find a way to get laboratory testing done uh, through a family member that had a license that would allow me to do that, and I started doing that. And the person who was teaching the first top blood chemistry ended up with Meniere's disease, and he's like, and I graduated chiropractic school in my mid 20s, and he's like, hey, I got Meniere's disease, and you know this blood chemistry stuff really well. Why don't you take over my seminar circuit? And I was like, okay. So I didn't have any source of income. I was just starting my practice, but I knew the
So
topic.
let me pause and interject here, because like, how did you feel in that moment when he said, "Why don't you take over my seminar circuit?"
Um,
And I have a specific reason for asking, which I'll tell you after you tell me.
well, to be honest with you, I thought, yeah, because because I invested so much of my own time into it, and I looked into this, and I thought, there's a lot of outdated information here. And I would love to update this. Of course, I didn't say that, and I was like,
Yeah. Now, how many years ago was that now? 20, 30, 80?
that's 25 years ago.
Yeah, it's a while, right? A lot has changed. So the reason why I paused and asked you that, and I don't know if you remember this moment, but um, there was a moment when I had gone to, in fact, I think it was the very first brain chemistry weekend seminar that you taught. I think it was in Fort Lauderdale, and there were a bunch of doctors from the Sarasota Bradenton area where I was at the time, and they knew that I had a background in neurology. And on one of the breaks, several of them came to me and said, "Hey, can you put together like a study group to help us integrate and learn more about this stuff?" And I, tentatively agreed. And so I went up to you on the last half of that break, might have been the next break, and I said, "Hey," and I had met a couple of times at that point, because I think this was third seminar, right? Because there was only three at that point, right? It was blood chemistry, the early funk endo, and then the brain seminar. And so I told you what was going on, and I said, these docs want me to put together a study group. And you looked at me and you said, "Why don't you teach for us?"
Right.
And I'll tell you, my mouth said yes, but my brain was screaming no, right? Because it wasn't because I didn't want to, and it wasn't. I think deep down, it wasn't because I didn't think I was capable. it was just like I couldn't believe that that opportunity was presenting itself to me, and because I was so fresh and I was so new, but I had put so much effort into learning and getting up to speed. So I just kind of wondered how that equated. Like, what was your experience inside? What was that internal dialogue like?
Right. Yeah, I totally understand what you mean. I mean, and for myself, I'm an introvert, and I've always had a hard time being in front of a lot of people. The energy of it, I always felt confident in my understanding of the concepts and
Yeah,
materials, and so I think that helped. But it's always tough being in front of people, being judged, and
yeah, sure.
and when you teach, postgraduates and where everyone's trying to outsmart you, and
Yeah,
someone's always
yeah.
like
You're the
the,
target, and they're trying to take you down, right?
always the douchebag there. And you got to strategically take them out with respectfully, and then move on.
Yeah,
Do the content, and
that's
the game where you play is does the sim numbers. So that's
yeah. It's
the
different. It's different when you're up at the podium, isn't it?
yeah,
Yeah. So listen, you mentioned two pretty big names in our world, Harry Eidner and then George Goodhart.
right.
Um, Clearly, they had a big influence on you. Who else has had an influence on you? Not necessarily to the same degree or the same way, but just in your career in general. Who's been big for you?
Of course, Jeff Bland. I think for anyone who's been exposed to functional medicine, Jeff Bland has been
Yeah.
the one who's had a huge impact. Arishta Vijdani, yeah, has always had a huge impact on me. Um, those were the two people that really had a huge impact on me. Mike Stone, I don't know if you know him, but he was just
No, I don't. That's an unfamiliar name.
a group of people that were a generation I just considered gentlemen. When I
Mm,
mean, like they wore a suit, they wore a tie, they were very classy, they were very respectful. And Mike Stone is in that group. George
yeah.
Goodall was, Wally Schmidt was in that group, and
And here I am without a tie on. I feel underdressed
in a barn.
in a barn. That's right.
So,
Yeah.
I just always respected people that knew their information, were respectful to other people, carried themselves well, represented their profession um, in high regard, and treated everyone like colleagues. And I wasn't always impressed by education or information. I was more impressed by people who carried themselves. There
Mm,
just was never a point where I felt there isn't anything this person knows I can't learn. I've never
yeah.
felt that in my life. I'm like,
Yeah.
you learn it, I can learn it. Someone else has learned it, I can learn it. So I always
Yes. Yeah.
about that. So I was always more impressed with how people carried themselves and how they treated others.
How they treated the other people. Yeah. So what about your professional development and your career trajectory afterwards? Like, most docs, you've done a lot of postdoctoral training and education, and
Yeah.
most docs in our field, at least the ones that I've interacted with or know about, if they do any postdoctoral training, say aside from CEU type stuff, they might do a master's in nutrition, or, if they're more business oriented, they might go on and do an MBA or something like that. But you went a completely different route, right? So and my understanding, you've got master's, PhD. I think you've got a couple of doctoral designations, right? The PhD and I think the doctor in health science. So kind
Yes.
of walk me through that, and really ultimately, I want to get to the why, because it's totally different, and I have to say that I think, certainly and I know our whole profession has benefited from that decision that you made and the work that you did. So what was behind that?
It really came down to the point where I think in my development, I met so many people that had theories, especially in the field of nutrition functional medicine. And I'm like, I don't know, I don't want to believe in someone's theories. I just want to know like what's real and what's truthful. And obviously that's when you have to go into research and just read research. And the problem is I really didn't know how to read research. I can certainly like read the conclusion, you know, and I just felt intimidated and frustrated by an actual research paper.
Mm,
And more so the methodology and statistical analysis section. So I just kind of looked at that as myself as that's a weakness. And growing up with martial arts my whole life, like if you have a weakness, you strengthen it, right? So
Hmm.
you someone throwing a cross and you don't know how to respond, you have someone throw crosses at you all day until you learn like how to defend against that or something like. So like I really need to learn how to do. I really need to understand study design and research. So I had opportunity to do a Doctor of Health Science program, which allowed me to still stay in practice and take courses, and then fly out to Nova Southeast University for these intensive institutes. And I learned about research there a little bit, but it wasn't to the level I wanted to learn it. So I got some basic understanding of like study design and methodology, and then I followed through with the PhD, which is a little bit deeper. And then once I got my PhD, I was trying to I was trying to really learn how to defend my thesis and study design, and focused on taking a postgraduate course in data analysis and statistics that Harvard Medical School had for researchers. It was like a certification program. I took that, and then there I met the senior associate dean of Harvard Medical School, Ajay Singh, and we became to know each other really well.
Hmm.
I got the opportunity to do my postdoc at Harvard Medical School with him as a mentor. He got me with I also knew Martha Herbert there. So I spent 5 years doing postdoc research at Harvard Medical School, the Department of Neurology, and I got to finish my Master of Medical Sciences in Clinical Investigation at Harvard Medical School. The Master of Medical Science at Harvard Medical School is you have to have a PhD or an MD to qualify. So it's like a postdoc master's, and it's just data analysis and statistics. So I got to do data analysis statistics for 2 years, and I was living in Boston.
Yeah. So listen, most people would listen to that and start dozing off just by the description, right? Because like people think about numbers and math and statistics, and I would venture to say that a lot of people that are in the world of natural medicine, kind of using that as an umbrella term, are not so driven by science and fact.
Yeah.
Right. I asked you, we were sitting outside, it was at one of the speakers conference that we had back in California. And I'm going to see if you give me the same answer, but I asked you then, I said, why did you, because at that point you hadn't gone all the way to the point where you are now. I think you had probably finished your first advanced degree. I can't remember which one it was.
Right.
And I asked you, I said, why are you doing this?
What did I say?
You said validation.
Well, validation was part of it.
And it wasn't validation for you, it was validation for the profession.
Yeah, I think at that time that was part of why I initially seeked getting higher degrees. Just, but also there's a point where I just got it's very important to understand. Like there's a point now, like if I read a study, I want to see if they submitted the raw data so I can do the data analysis myself and see what's
Wow.
there. You're surprised what should not be published. And
well, and it's funny you say that because I've, this is the first episode in what I hope is to be many. And I've mapped out kind of like a mini series or at least a subsection category of podcasts where I want to talk to people like you about research, about how to read it. Because, if you get out on the internet these days, there's, non-credentialed people who are talking about, hey, did you see this new paper and look at the research and look at all this? And, I really think that we're at a place professionally that we should probably know this stuff. Like the average practitioner should know how to look at a study and go, good study, bad study, and know why. Not necessarily do the study, but at least to look at it and go, okay, I understand why this is a good study or not.
right. And also, the thing is like research is its own area of study. You don't just get to know it if you're a doctor. It doesn't matter what kind of doctor you are. I mean, there's like some kind of arrogance. Well, this person is an endocrinologist, this person's an internist, that they know research. They don't.
Hmm.
They just don't. Like unless
Yeah.
you've had specified training and understanding. I mean, a simple question I always ask people when they start quitting research: well, just tell me what a p-value is. What's
Yeah.
the math significance of a p-value? Like, and most they're like they don't know. when people say stuff like, if it is not randomized clinical trial, I don't read it. I'm like, then you're an idiot because you can't use randomized clinical trial for every study
That's
hypothesis.
right. Yeah, you can't. Yeah.
It's like, and it's like you just get so tired of people. I don't do anything with that research. You're like, you don't even know what research is. You don't understand it. You know how to interpret it. You just use that term. And it happens so much. It happens much more in conventional medicine than alternative medicine. And it's one of those things that sometimes conventional medicine people use it to intimidate other people with, right? And it's like, it's 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 just arrogance. So I think there's a big problem with that.
Do you see that a lot in the world of academia and research? Just that, the intellectual arrogance.
Academia is a bit different. I can tell you, when I work at the Loma School of Medicine. It's very different. The PhDs and MDs are two different communities, two different.
Mm-hmm.
The mindset, the way they think, is totally different.
Mm.
So there's definitely a serious problem with let's just say just a physician that doesn't have training in research trying to interpret research. It is a big problem. It is a big problem. And then when some count on is just the journal's good, they'll use it, and that's true too. I mean, having a good journal review is important. Where it's published does matter, but at the same time, there's certain papers will never be published in certain journals just because it's not of interest to what the journal's purpose is. Like the New England Journal of Medicine is the number one index factor, the highest rated read journal in medicine in the world, and they will only publish papers that dramatically changes medicine, which means like a large clinical trial from a pharmaceutical agent. And when I was doing my postdoc and my master's in medical science at Harvard Medical School, a lot of our professors were editors from the New England Journal of Medicine, and we were able to spend some time there. And it's a very serious place. Their papers that they publish are very much focused on a certain area. So you're not going to get a paper published in there on like vitamin C impact so and so is because it's not going to change the world of medicine. That's how they think, right? A large clinical trial with 10,000 subjects that is doing an FDA approval for a new drug that may change cardiovascular disease is going to get attention to be published there.
Yeah.
So there's those factors that are there. Even with the New England Journal of Medicine, which I thought was really interesting, is when we got to go to, so the way it works is like when someone submits a paper to the New England Journal of Medicine, it goes through the associate editors first. There's three of them. They decide to whether they want to even accept that paper for review. Then once they accept the paper for review, they send it out to three different reviewers. And then if all three reviewers accept the paper, say it's worthy of being published, then it goes to a committee at the New England Journal of Medicine. Did I get cut out?
Yeah. Yeah. So you said the way it works is with the New England Journal of Medicine, and then I lost you.
Yeah, so it works with the New England Journal of Medicine is like when someone submits a paper to them, it gets reviewed by the associate editor first. They decide if the paper is worthy enough to be published. Then it goes out to three reviewers that are experts in the field, and all of them have to say yes, that it's publishable. And if any of them says no, the paper is immediately, declined for publication. All three say yes, then it goes to an editorial review. And the editorial review I got to witness once. It's like 40 top researchers in the top floor of the Harvard Medical School library, and from each different specialty. And then there's the chief editor, and then they'll have a discussion whether the paper should be published and if it should change medicine or not. And they all have to agree on it at that meeting, even though three reviewers have said yes. Wow. Then it's still not published. Then it goes to statistical review. Then they have to send in the raw data. They have their statisticians look at the data and see if the data was done correctly. And 1/3 of submitted papers from top researchers in the world get denied in the statistical review section at the very end. So which tells you, even at the highest level of research, these stats are being done wrong. So that was a big eye opener for me.
It is, yeah. And I've got a couple of takeaways from that. Is on one hand, you want to have a gatekeeper system, right, to filter out the bad stuff. But at some point, it becomes so onerous that sometimes I would imagine that even good research doesn't get published because maybe, again, like you said, it's not part of the interest of the paper or the personal bias or preference of the reviewers or something like that.
Right. So there's something called publication bias, where each journal has their bias based on what they want to publish in their journal, what the purpose of the journal is. That's why, like, you're not going to see some of these alternative medicine clinical trials in the Journal of Medicine. Not that the research isn't good enough, but it's not what the goal of the journal is. Their goal in the journal is to only publish papers that are going to completely change the field of medicine, right?
Yep.
So, like a clinical trial on huperzine that may benefit people with Alzheimer's is not going to raise to that level. So, but it can be published in, let's say, a Journal of Alzheimer's Disease, and that could be a very good journal. And the impact factor is maybe like 6 or 7, which is still very good. Like, whereas New England Journal of Medicine's impact factor of 39, 40. But, the more focused you get on a topic, the lower your impact factors as a journal. So New England Journal of Medicine is read by all specialties in medicine, so it has the highest impact factor, highest readership. Right. But as you get into like the top journals in diabetes, their impact factor may only be 7.
Yeah. So you did your work at Harvard.
Yeah.
And you've published several papers, and I think I've read all of them. Towards the end or at the end, you were named Harvard Researcher of the Year, which an amazing accomplishment. Of course.
No, I was not. I don't know.
Oh, you weren't. What? So did you get something from Harvard? Some award?
No, I didn't get any awards. I just graduated.
No, where did I get that? Wow. All right, I must have dreamt that.
People start spreading rumors.
Okay. Yeah. Well, I could have sworn that I saw that announcement or something somewhere. Okay. Well, we'll scratch that. We'll just edit that conversation out, or we'll leave it in there and just have a good laugh at it. But I mean, what was the experience like? Not in terms of the climate and the environment, like you just talked about. Is there, when you're in the lab,
at Harvard Medical School?
Well, just in research in general, like when you're in the lab and you're doing your work, you're pursuing whatever topic it is and trying to answer whatever questions you have. Like what's that like? And of all the papers that you've published, which one or ones are you most proud of?
Okay. So I would say, first of all, I'll answer your question. All the work you do as a researcher is lonely. It's non-stimulating. You have to motivate yourself. No one in the world cares. You hope to finally write it. Hopefully you get someone to edit it for you. Make sure you don't have typos. You submit it to a journal. Reviewers read it. And then you get criticized on things they don't even understand sometimes. And then the whole process is not fun. And
so you're saying it's not glamorous.
Not glamorous. It's a lonely process. And, it takes a special personality to do that. Some people get accolades in their academic environment for doing it. Some people are just passionate about the field of area they're studying and do it. So, you really have to want to do it. It's not easy, and it's lonely, and it's not fun, and it's very time consuming. And you can work on a manuscript and a paper for a year and a half and submit it, and then it won't get published.
Yeah, and then nothing happens. Yeah.
Like that just wasted a year and a half.
Yeah.
Hopefully you figure out how to correct the paper and rewrite it to make sure it's publishable, or sometimes the papers.
Have you had any papers that were denied?
Yeah. The paper that I finally got published, I think it was published in a Journal of Molecular Science. It was a paper that I published where we looked at thyroid antibodies binding to chemicals and specific chemicals impacting specific target sites of the thyroid.
Yeah.
And I remember the editor, he's like, I can't even get anyone to read it. I can't even get a reviewer for it. He goes, your title needs to change. So I changed my title. And then he's like, I still can't get anyone to even want to read it. No one cared about chemicals binding to albumin and then that causing a neoantigen and then causing antibodies that cross-react with target sites. Like no one cared. So there's anyone in the field as a reviewer, because when you submit a paper to a journal, the journal editor then sends it out to other researchers, and the researchers that pick to review paper are usually interested in the topic.
Yeah.
So I remember I went through 4 different journals before I finally got 2 reviewers to read it. And then I'm like, okay.
Well, and that's, that doesn't surprise me on one side, but it's such a tragedy because information like that is so important for us.
Yeah, and for us, it's really critical. Yeah,
yeah.
But for most of the people doing research in other areas, they just weren't interested in it. So that can be frustrating at times. The other thing I would tell you is when I was around researchers exclusively, so my time at Harvard Medical School was with the research world community, not with the medical education community, because they're two different communities. And in the research community, it was the most humble, brilliant, dedicated, open-minded people I've ever met in my life. No ego. No one calls each other doctor. Medical school. Mm-hmm. They just use first names. They don't care if someone's a student or not. They're all highly accomplished. No one talks about themselves. The culture of even trying to talk about yourself is just looked down upon. And the willingness to help each other is amazing. So I've never been in an environment like that in my life.
That's good to hear.
Which was awesome. And they were very much open-minded to alternative medicine. I mean, there's some major research being done on the microbiome and food sensitivity and chemical reactivity and toxic chemicals and different environmental triggers for autoimmune disease, all being done in Harvard Medical School, which is our field of functional medicine.
Yeah, and I have you mentioned Ari Vijayani a few minutes ago, and he's going to be a guest here in a couple of weeks. And one of the things I've always appreciated about him is that he seemed to have a grasp of our community as clinicians and the clinical challenges that we face in puzzling out complex and chronic conditions, and the research, bring out relevant information, and translate that not only into research but into testing technologies. Thinking about some of the stuff with Cyrex Labs, where there's a array 11 with the chemical immune reactivity or whatever the case might be. And you're kind of, you slipped into a similar role, but you came at it from the clinical side.
Yeah.
Right. So you started out as a clinician and you're still a clinician and you understand the challenges that a lot of us face, out doing the work, if you will. But now, I mean, are you in a position where you're like, finally, I can get answers to the questions I've had for years?
I'm actually in a position where I don't even know what it's all for.
Really?
Yeah, because we don't even have any grasp of really all the variables involved with a real patient. We try to do our best in a model that we call functional medicine or some other kind of model.
Yeah.
And we can get results in it, but it's almost luck, and it's almost the fact that the body is so efficient at attaining homeostasis that you just remove some barriers that can get there.
Yeah.
But it's definitely not as linear as we make it. The variables are
when I first started doing this work and I first started teaching for you, and I still use this phrase today. I tell people a lot, especially if there's a bunch of new docs, that maybe the seminar that I'm teaching is the very first one in the field of functional medicine. And I'll say, here's a big disclaimer, is that your patient's body and physiology is under no obligation to follow anything I tell you this weekend.
That's a great quote. Yeah. It's tough because as an educator, you're trying to make something that's complex linear, but then it's never linear. It's never that straightforward. So.
Yeah, and I think that's actually no. Let me ask this question because I want to get to it, but I want to come back to this because I do want to talk about in your experience and the 20 odd years that you've been in practice, how you've seen functional medicine change. I want to come back to that, but I want to talk like one question about the papers that you have done and gotten published.
Yeah.
Which of those papers would you do again, but do it better, or would you like to do follow-up research on?
Oh, all of them could be done better. Every single one, and so that's for sure.
Okay. Better in what way?
You could always have a different slight of the study design. You could have always add a new variable to check. You could have always accounted for more confounders. There's always a way to make it better. There's a point of what are you capable of doing at the time with the resources you have, and can you get something that has some meaning out, right? And that's the balance. But there's always ways you can improve. Yeah. It may not be feasible and the circumstances you're in, right? I might not be able to draw 15,000 patients for its clinical trial as,
Yep.
as sole investigator.
Sure.
So, but maybe you can get blood samples of 200 people or things like that, right? So it's a little bit different. So
Yeah.
everything can always be done better for sure. And
Yeah.
I just wish I had more time to do research. I'm really at a point in my career where, you know, I make my income to serve my family by seeing patients and teaching. Um, but so research requires a lot of time, and it's just not financially rewarding. So you kind of do it as a passion when you can with what you can do.
Right.
It's expensive and time consuming.
Yeah. No, I can understand that for sure.
So as far as new research, I mean, I have a couple of papers that I'm finishing up here. I got the data set of 400 people with leaky gut and autoimmune markers, and I found statistical relationships between different autoimmune diseases and intestinal permeability in human subjects was never been published before. So I want to try to get that published early next year. So it's like your goal with research is two. One is you're trying to find new mechanisms to help understand questions. Like when we did the paper in cross-reactivity for foods that cross-react the thyroid, that was important because that could be clinically relevant.
Mm-hmm.
Other times you're doing research because you know a model to be true clinically, but there's no real published information on it.
Yeah.
There isn't human studies that show leaky gut has statistical correlation with developing autoimmune disease in humans. It's not been published. In animal studies, they've done it.
Yeah, and I know that with diabetes, particularly, right? Type 1 diabetes.
Right.
Yeah.
So, yeah, in animal studies have done two, I think there's two papers published for type 1 diabetes in animals models where they cause leaky gut. But as far as like that, there isn't that field. So I'm like, okay, well, I have all this data. I can publish and show this really nice, clear evidence of this relationship. And since this is a big topic of what we're doing in the field of functional medicine, let me try to get that published. So the intention is for that paper not to change how we practice, but to validate what we do.
Right.
So
yeah, and on that, just a quick side story. I remember years ago, I think it was first when we moved to Tampa. I had worked with a lady who had, I mean, quite literally, I think it was a 20-year history of chronic diarrhea. And I think it was within 3 months she was, having normal bowel movements and all that kind of stuff. And part of her clinical presentation was leaky gut, and so we had done stool testing and Cyrex's array 2, and she took that data and went to her gastroenterologist who had been working with her for 20 years and failing. And when she told me that when her doctor was flipping through the paperwork that she had brought in saying, hey, I haven't had diarrhea in a month and all these wonderful things, the doctor got to the leaky gut test, crumpled it up, threw it in a waste basket and said, we don't believe in leaky gut. And she was a gastroenterologist.
Yeah, and that's just really an idiot. I mean, that's
yeah. I mean, that is, you may as well wear a T-shirt that says, I don't read my own research.
It's not even that. It's just that the high level of bias that they have, and all practitioners do in their own way. Like you're not going to convince a naturopath that certain philosophies don't work or certain things are that way. And it's the same with medicine. That's the thing I've learned most in my career so far is so much bias in everything. So much bias in natural medicine, so much bias in conventional medicine. And then how do you kind of read through the bias and how do you judge your own bias? And then, but bias can also be a strength because it can help in certain circumstances where your bias is useful. I don't know. It's tough. There's times where I remember once I went out to dinner with one of my mentors when I was in Boston with Martha Herbert. I don't know if you know Martha Herbert. She's a brilliant.
I know the name.
She's an MD, PhD, neurologist, neuroscientist. She has her own lab at Mass General Hospital. Just a brilliant person. And she was my main mentor when I was there. And I'm like, Martha, I don't want to practice anymore, and I don't believe in research anymore. And I don't know.
Oh, wow. Pretty low point. That was before you took the dopamine support.
And it's like the reality of how complicated everything is like really hit me. And I was like, but then I go, but at the same time I go, I know there's a countless amount of patients I've helped, and I know there's countless amount of patients I know what to do for that can make a huge impact in their life. So I don't know how to interpret that. At the same time, the research is still good. We got stuff, but I can't trust any of it, and I can't trust anything I do, and I can't even trust my own interpretation. And it was not a good place. So it's in a period of depression for a few months. I don't know if
But
I've.
honestly, I think like if you could map out the evolution of a functional medicine practitioner, somewhere along the way they hit that road bump, right? Or that
Right.
speed bump where
Yeah.
you're just like, why do I even try?
Right.
Right? Nobody's getting better. I can't figure anything out. Everything I do is wrong and doesn't work. And then
Exactly.
you get one case where you do simple things and it changes their lives and they sing your praises and they're bringing you presents and you're like, okay, now I remember why I do this.
Exactly. That's very true. Yeah.
Yeah. So that's a good pivot to talk about like what kind of changes have you seen in functional medicine? Because I find myself fairly frequently drawing distinctions between functional medicine, say, as you and I would understand it,
Yeah.
and comparing that to, let's call it historical nutritional medicine.
Right. So I think there's a big difference between the specialties. Like conventional nutrition, you're looking for a deficiency, right?
Yep.
It's the nutrient deficiency, and you're hopefully, well, they're deficient in magnesium, so now I give magnesium, and their blood pressure is normal, and their depression's gone, and their constipation's gone. They were just a magnesium deficient patient. That's the basic nutrition model. Then you have an herbalist, which is just like, well, here's your herbs for these conditions.
Right.
So it's like green medicine, and green medicine nutrient deficiency is still not functional medicine. Because functional medicine is based on trying to figure out what areas of the body are not functioning, whether it's the blood sugar system or the endocrine system or the immune system, and then how do you restore function specifically by doing objective testing. So if someone has got a chronic virus, they can't get rid of it, maybe their NK cells levels are low. And you can do literature review and see what things can raise in natural killer cells. So you can see what lifestyle factors suppress natural killer cells, and maybe find out they're overtraining and their cortisol's high.
Mm.
So you fix that, you can't get their viral response down. So maybe you try that attempt clinically, and then maybe it works, maybe it doesn't. Maybe they're 40% resolved. The whole process of going through to restore function is really what functional medicine has always been to me. Now it's like turned into a bunch of protocols, and what I don't like about where it's going is statements like, if you don't know where you start, just start at the gut. And it's like, oh, no. Or, then you get your biases. Biggest bias in functional medicine is what practitioners have done to help themselves.
Yep.
Someone had mold issues, they think every patient has a mold issue. It's the practitioner bias. If some practitioner did some kind of adrenal recovery program and helped them, they think everyone's got exhausted adrenals. And there's a point I would always remember when I used to teach seminars all the time, someone would give me a card and they would be like, I don't know, hormone center or thyroid center or so-and-so. And then you go, okay, you have a thyroid problem, right? How'd you know? Like, because you're an expert in this topic. This is So I think it's normal. I think we all get biases. We tend to think what things help us must be what helps other people. It's not always the case.
Yeah.
So I don't know. I don't know what's going to happen in functional medicine. I know as an educator, I started the Kharrazian Institute. We have about 3,000 practitioners taking courses in the Kharrazian Institute. And, I think a lot of them are new, and maybe like 10% of them, like a top 300, are unbelievably sharp clinicians that we can all learn from each other from, that are just amazing in that community. And then, there's people that are brand new and there's people in between. But for the most part, the difficulty is trying to grasp what's happening. And it's like you can't grasp what's happening if you don't understand physiology. So I think one of the problems with functional people is they just don't remember their physiology.
Yeah.
And they just want to go to a protocol. So way too many labs are ordered, way too many supplements are handed out. There's way too much focus on supplements versus various variables that may be impacting their chief complaints. So it's turned into conferences where people are bombarded by vendors that are just labs and nutraceutical companies. And functional medicine is sometimes swayed into, if you're really good at it, you're going to order a lot of labs because you can look for more things because you're more thorough. and then you're going to give a lot of supplements because you're thinking of all these different mechanisms. And it's like, that's the worst way to practice functional medicine. So I think that's the area that has to be navigated. And I think when people practice functional medicine, they eventually get there, but when they first start, it's the common place to end up.
Pardon me. In many ways, I found myself kind of coming full circle.
Okay.
Like in the beginning, I didn't do a lot because I didn't know a lot. And I only did what I knew because you can't do what you don't know.
Right.
And then you start learning and you start doing more and you start ordering more tests and trying to fix more than one or two mechanisms at a time. And so, people are on a dozen different supplements. And I find myself now trying to do more with less, which I know is something that you talk about a lot in the Kharrazian Institute courses, where you take a system or a problem and you paint the physiology of that.
Yeah.
And then you quite often will make a comment about, we need to figure out where to tug on the web to affect the greatest change.
Yeah.
And that can be challenging. Going back to this concept of biochemical individuality, you can have two identical cases on the surface that present the exact same way, but what you end up doing with them can be radically different. And that's, I call it mental flexibility. Like you have to be willing to look at somebody and go, okay, well, I think this, maybe it's that, but maybe it's not that. And I might commit to a course of action, but I've got to be mentally flexible enough to go, this isn't working, let's go do something else.
Right.
Would you agree with that kind of a perspective? And have you found yourself in some ways coming full circle as well as a clinician?
Yeah, I think that's normal evolution. You don't know much in the beginning, and then as you learn more, you test more things, you test the waters, you do more testing, and then as over time you try to fine tune things. I think, and it's probably similar with you. I'm at the point where I think we all end up with is just like, I can't predict how you're going to respond, especially when you start working with lots of chronic people. Everything you do and how you respond is a clue to us of where we need to push and pull more.
Yeah.
So I kind of always just think, and this really has helped me not want to quit practice, because if you know it's a process, if you know it's a journey, and you're pulling across different things you think can make sense, and you're trying to get to the answer, then you can usually find different ways to help a patient function better, right? And again, I don't like to use the word cure, but let's just use function better, right?
Right.
And that's what I try to explain to patients when I work with them and go, I go, this is a journey, this is an emotional, psychological, physical endurance battle. We're gonna do what makes the most sense, and I try to educate them. A lot of times I'll have with two options. We want to stabilize your blood sugar first for the first 30 days, see what happens, or we may want to really try to reduce your inflammatory mechanisms aggressively.
Yeah.
I really don't want to do both at the same time, because I just want to see what part of your seed complaints are inflammation and what part of your symptoms are blood sugar, so we can kind of navigate that. Where do you want to handle? Where do you want to go first?
Yeah.
Sometimes I've learned just asking the patient when I'm not sure, when they're just between where do they want to go first, really makes a big difference. Getting them involved with the process, having the co-investigators in their own case, share information with me, working it through it together, has really helped me become more efficient in practicing functional medicine. Whereas before it was like, well, the lab tests show this, that's the protocol, and you're never going to get them cured unless you fix their leaky gut. It's like, well, causing their leaky gut, well, maybe not, or what can we do this with? And I think over time I've learned the most important question to ask is, what have you done that's made you feel better and function better? What have you done that's made you feel worse? And if I can go down those two pathways, I can really start to figure out where the next step is. Sometimes you're like, let's just do everything that's made you feel better and see how you do for the next.
Yeah, let's do it. Let's do it again.
It's all there.
That's right. I think that when you have that long-term perspective, like you said, it's a journey and it takes endurance.
Yeah.
It's a lot easier to kind of settle down and think through your problems. Yeah. And especially in the last 10 years or so in our profession, there's just been a lot of, and I'm not saying they're all bad, but there's a lot of these practice management companies that have, coaching companies that have cropped up that tend to try to standardize practices because that's how you run, scalable, busy businesses.
Yeah.
And that's great if you want to work with, maybe 20% of the population where all they need is a leaky gut protocol or anti-inflammatory diet and a detox.
Right.
But it's not going to work with the clients who've done all those things and it didn't work, or they've done a dozen other things. And practices, that's the kind of practice I have. I'm pretty sure that's the practice you have. And a lot of us now are developing that. So again, I'm not saying that practice management companies are all bad, but sometimes like I will periodically get docs that are just getting in, and they might be in practice for many years doing something else, and they want to start getting into functional medicine, and it's just they want me to help like coach them basically on a one-on-one basis. And one of the first things I start with is like, you got to pick which game you're playing. Like, are you the one size fits all doc that just wants to see a whole bunch of people and do simple things and run numbers through? And are you happy with that? Or do you want to be the doc who can figure out the more complex cases and take your time and work with a lot more detail with people? And then because I think there's a lot of docs who want to be the go-to guy or lady for the complex cases, but the way they're practicing doesn't serve that at all.
Right. Yeah, and that's, I think, an important distinction. And the reality is society needs both types of people. Some people do tremendously well, just do some basic anti-inflammatory dietary things and some basic gut support, and they can really have a huge impact on their function. And then there's people that go deeper. And then I think it's good that you're having people identify, like, what do you want to do? How do you want to handle it? I think that's pretty smart. I think over time, a lot of practitioners, they just end up seeing harder and more difficult patients. And then what happens is like they don't have like the fee structure and time structure to make that work for them, because now they're spending countless hours with a difficult case, but they're not being able to be compensated for it. But they still have the same overhead. They still have limited time per week to see patients, and then they can totally burn out too. So
exactly.
I think what I've learned with many friends that are functional medicine practitioners is some will make that leap and go, okay, I'm seeing more difficult chronic patients that are taking much more time, and I need to start charging for my time. And whereas some of them are like, well, I just charge a new patient visit. It may take 1 hour, it may take 5 hours, the same, and then they can't survive.
No, you can't sustain that,
and you will also burn out because you're not just getting a return in your time that you're putting into it. So it's easy to completely burn out. So it's a good thing you're pointing out. So if those that are doing functional medicine, they should be aware of that. And also, if you're a patient looking for functional medicine practitioner, they're not all the same. Some have models where it invests more time, and the bad thing with functional medicine is it's also can be, especially when you do personalized. In functional medicine, the key thing about it is that it's not generalizable medicine, which is what a clinical trial is. It's generalizability for the whole population for a disease. It's personalized medicine. And personalized medicine means it requires a lot of in-depth evaluation of that person, and then trial and error to see what's working for them. And that's time-consuming, and it's also expensive.
Yeah.
Versus the time of energy needed in diagnostic testing. So it's not an option for everyone. That's the sad
Do you
thing.
like the label functional medicine?
I don't even use the term, to be honest with you. I mean, I use it as a way for education because I think what I teach is functional medicine, but as a practitioner, I've never used the term functional medicine. I think for most people, they just get a referral from whoever they're seeing based on it. They don't even know what you do. I think Jeffrey Bled was very smart by relabeling, like when he went to go on and do his own annual conference, preventive lifestyle medicine. I think that's
personalized lifestyle medicine. Yeah,
that was a much better term to be used. In functional medicine, because personalized lifestyle medicine. Oh, that makes sense. I understand what that is.
Yeah.
I'm like, what is functional?
Yeah, and there's no governing body that actually defines what's included in the term functional medicine.
Right.
I mean, we can be in a room of 30 docs and we all say we do functional medicine and we all do vastly different things.
100%.
Yeah, and you're right. I mean, the average healthcare consumer doesn't know. Like they walk into someone's office, and unless they're savvy or willing to basically interview the practitioner, they just have to buy into whatever clinical model or practice model that person has, and
Yeah.
they might be getting something completely different than what they're expecting.
Yeah, absolutely. And it's also normal. Like if, let's say we pick 10 of the functional medicine practitioners we both totally respect as great clinicians. Okay.
Mm.
And then we have this patient that needs help. If we send him to the 10 people we handpick, they're all going to have different starting points and different wheres to
Yeah,
go. But at some point, they'll work through the case
yeah,
and be able to get to somewhere. That's
yeah.
some point improving the function. So, and that's to say that's just diversity of functional medicine and how it's practiced and how people do it is okay. The main philosophy being you're trying to upregulate, enhance function. When you look at pharmacology, everything's to block, inhibit, right? Beta blocker, protein
Yeah.
pump inhibitor, serotonin inhibitor, and functional medicine. There's no blocking or inhibiting. It's all about upregulating, improving
Mm.
function, however you do it. So,
Yeah. Yeah. The the whole concept of working through a case seems to me to be the underlying theme of all the courses in the Kharrazian Institute. What led you to put that whole thing together? Like, was that the next logical step in like an educational career? Was it a natural progression? And how far are you going to take that?
so I'll be honest with you. I just thought I'm getting old, and I need to. I don't know how much vitality and life I have left in me to how many or how often I want to teach. Let me just get this what I know down. So I wrote an outline, and it was 18 courses, and I
Mm,
had to fine tune. It was 13, and then it was like 300 hours. And I'm okay. This will cover a really good outline of functional medicine. And then as I got into it the second year, I'm like, it's not. It's this is not. People aren't going to learn this because I have a course on neuroinflammation, I have a course in diabetes, I have a course in autoimmunity, and I talked about those topics. But a real patient may take different parts, different courses in. And then we started to do the clinical mastership program where I do real life ground rounds with my real patients, and we go through the process. So they see me do a history, they see me do the workup, they see the follow ups. We have successes, we have failures, we have people that just quit.
yeah.
I think the
But
real,
what do you mean, like real practice?
yeah, like real practice.
Yeah.
I don't handpick them. I don't know. I honestly don't know how the cases are turning out because we're doing them in real time. Like I'm seeing a new patient. They're going to get taped. That's going to show up in the next 3 months. And then we're going to do some follow ups. That's going to show up throughout the year. They may respond. They may not respond. And
Yeah.
that's what I want people to see. And I think one of the frustrations with people functional medicine is like, if you're not getting people better all the time, you're doing it wrong.
Yeah.
No, you're not the only variable. Like there's so many
Yeah.
other variables besides you as a
I
clinician.
like that. You're not the only variable. You
Right?
know.
So you do the best you can. You go through the process. So I think once I finished the 300 hours of courses, I think we're on course for finishing number 12. Um, we have 16 to go. Some 4 more after that, and then another year of the clinical master program. Then I'll have to like take a little break and figure out what the next step is, and see what people's interests are. Um, I might just practice and not teach anymore. I mean, I don't know. Like, there's you only want to teach when people want to hear the information, and also
Yeah.
like this is what I know. I hope you liked it.
Yeah. It almost sounds like the whole Kharrazian Institute is almost like a legacy piece. You've left your mark on, and then, I was thinking about this question before you and I got on today. And I don't know if this is true or not, but certainly in my experience, it seems like you were either the first or one of the first people to bring like a systems analysis mindset to the world of natural medicine. I mean, can you correct me on that? Is that true or not true?
um, I, I would have no idea. I'd probably say it's not true. I'm sure there's other people, but certainly that was my intent. Just I've always just tried to go. The thing too is that when you look at education, so many people teach that don't actually clinically practice.
Yeah.
And you're like, I remember when I was finding speakers for Apex, and when you jumped on board, I was like, there's no way in the world we're going to bring anyone to speak that's not in real life practice.
Yeah.
Because all the other options, well, they're charismatic, they're great, people love their personality. You're like, it doesn't matter because within 15 minutes of someone speaking, if you're a real clinician, you can tell like this guy is not practicing, right?
Yeah.
You know that. You've seen it yourself, right?
Yeah.
So what I don't like, what I what I what I see so frustrating is when people have to teach, they always show like their best cases or their best outcomes or how things actually worked. It's so good to see things not work. It's so good to see things fail. It's so good to see readjustments from when something didn't work and
Yeah.
then some improvements. And I think if you don't do that and you work with chronic patients, you will absolutely 100% burn out. And that's a shame because if you have the skills, you can help a lot of people. And if you understand it's normal to have those responses happen,
Yeah.
it's important. So with the Kharrazian Institute, I'm just trying to be as honest with people. I mean, when you teach and you have people when you have a camera crew in your office when you're filming live patients, you know how it is. It's putting yourself in a very vulnerable position.
Well, it takes a lot of chutzpah. I mean, just to be able to put yourself out there like that, warts and all, and say, listen, I screw up people sometimes.
Yeah, and here it is, and I'm doing the best I can.
Yeah.
And this is the depth of the case that I can go. Maybe some of you can go deeper. This is my ability, and then for some people, they have to maybe they're new, so they have to work into it. I don't know. I'm trying to share what I know while I know it.
Yeah. So let's start bringing this to a close. But I do have a couple more questions. You can keep them brief and short if you want. But, one is what kind of advice would you give someone who's just getting into functional medicine? And what advice would you give to someone who's in functional medicine, been there for a while, and feels like they have stagnated in their development?
Okay, well, if you're getting into functional medicine, it's really fun. you're you're gonna have no shortage of time being excited as you're learning new things and implementing new things, and realize you're not doing anything wrong. You're just going at an approach. You may have different explorations of your growth where you're focusing more on one part of a physiological system because you're spending in time investing in it, and that's totally okay. And your patients will be your best teachers. They will tell you what works. They will tell you what doesn't work. They will tell you um, how they're responding, not responding. So just listen to them. Be excited about the challenge of something you don't know walking into your office and working a way to figure that out. That's how you really develop your skills. And realize that your time with each patient is a total privilege of an opportunity to learn. And that's great. For those that are in it for some period of time and what was the thing, they're getting burnt out or tired or not sure.
Well, some of them, they feel like they've stagnated in their professional development. Like there's like, and there's kind of two sides to that. One is the person who knows that there's a lot that they don't know and they're stagnant and they want to get better. And then there's the stagnant practitioner who thinks they have everything figured out.
Yeah, if you think you have everything figured out, you should just quit.
Just pack it in.
I mean, you're really dangerous to the population. You just need to go away. um, and it's okay to go. These are my limitations. This is far as willing as I'm to go with my model. Anything past that, you need to refer you out to someone else that's going to do more. I can understand that.
Yeah.
Some people like I can't take a deep dive for 10 hours on something like I don't work with cancer patients. I don't work with certain conditions. I don't work with certain circumstances. Because I have limitations and I pass them. So it's okay to have limitations, but I think it's normal to get burnt out. I think when you get burnt out, it's just because you need to learn something new.
Mm-hmm.
You haven't learned something new for a while. It's very hard to be excited. As soon as you learn something new, it's just fun to be back in practice. And especially when you have something lights turn on and go, oh my God, I can think of 5 patients where I should have done this with them. And I didn't know about that. And so if you're feeling like you're stagnant, that's because you're not growing. You need to figure out new things. Which environments to learn new information.
Yeah, and I've adopted the mantra that the more I learn, the dumber I feel.
Yeah, that's normal.
You
That's
know,
good.
and every class that I've ever said that to, all the docs who've been practiced for a while have all gone like, oh yeah, that's so true.
Right.
Yeah. Wow. All right. Two final questions. Tell me something on the personal side. Like, what do you and your family like to do in your spare time? And if you have time just by yourself, what does Datis Kharrazian do?
Our family, we love to travel, so we planned every year we take July off, and we, as a family, pick a place to go. We think about a year, and we plan it out. We try to learn about the culture, and we all make sure that that's a time where the only time is to experience something new together and something we cherish as a family. So we do that every year as a family.
Wonderful.
And then for me personally, I do Filipino martial arts. I do full contact stick knife fighting. I've been doing
I
it since
didn't know you still did that.
I still do it.
Nice.
Older as an old man.
Yeah.
So that's where when I have free time, that's what I love to do.
That's amazing. That's amazing. All right. One piece of advice for me. Who would you suggest should be the next guest on this podcast?
We said you've already Vijitani, right?
Yeah, Ari's coming. I'm actually going to talk to Tim Katke as well.
Yep.
But, you know, as far as I'm concerned, this podcast is going to be an ongoing concern. And so my main focus is to talk to industry leaders, trailblazers, people who are at the top of their game, people who own or direct labs. I want to talk to people in a wide swath of different domains within the world of functional medicine. Um, so, what do you
Wow.
think?
There's no shortage of people.
I might hit you up for a list.
Okay. Yeah, I mean,
Give, give,
for sure you want
give
to
me
look at
one name.
one name.
One name right now.
Can't.
Because you can't leave everyone else out, right?
Yeah. Can't.
Understood. I put you on the spot. My apologies.
Hey, Steve Noseworthy. Steve Noseworthy. You want to interview Steve Noseworthy?
We have to interview myself. Fair enough. Well, I want to thank you. This has been a great hour and 10 minutes or so. I truly appreciate it. Where can people find you? Like, again, this is going out to practitioners. So you want them to go to Kharrazian Institute? Give us some of your details.
Yeah, I mean, my information for people that want to learn the model that I've been organizing for functional medicine is the Kharrazian Institute, Kharrazin Institute. It's a long name, but
I'll put a link when I publish the episode. I'll put a link out for it.
Yeah, so that's where all the information is, and then I have information that I put out to the public, but has lots of updates on research and information, other things at my other website called Dr. K News, drknews.com. So those are
excellent.
Yeah.
Sounds great. Thanks, dude.
Thanks.
All right, take care.